Welcome to this informational video on EMR certification in Manitoba. In December 2015, Manitoba released a new EMR certification approach based on lessons learned from the past 5 years within our own province, information gathered from a cross-Canada jurisdictional scan to align with work being done in other provinces, along with a strong call-out from Manitoba's physician community for more choice in EMR products. The goals of Manitoba EMR certification are to certify EMRs that have the ability to support the strategic and operational objectives of Manitoba, as well as the end users of EMR products over time. Provincial standards ensure EMRs have a solid foundation to support delivery of quality patient care. Provincial standards also support information sharing and interoperability between primary care sites and specialists to improve continuity of care, consistent and measurable preventative care and chronic disease management, advancement of primary care renewal efforts, and consistent data collection and submission to support health system planning. Manitoba's EMR certification is a non-competitive open process with information publicly available on the Shared Health website. The process focuses directly on the EMR product to determine if it meets a baseline set of clinical, administrative, privacy, and security requirements critical to support core clinic operations. Certification also helps to ensure the product can reliably and securely integrate with Manitoba's provincial services, such as eChart Manitoba and eHealth Hub. Certification also focuses on components that support participation in certain provincial initiatives, for example, home clinics. Certification does not include assessment or evaluation of the product's usability, the EMR vendor's financial viability, or their ancillary services such as pricing, EMR implementation, and support. Within certification, EMRs must meet all the applicable assessment criteria with a 100% pass rate in order to certify against any component. As the scope of EMR certification is focused on the product itself, purchasers will have the responsibility to ensure that both the product and the ancillary services offered by the associated vendor meet their individual needs. As clinic needs may vary based on practice context, two main levels of EMR certification are available. The flexibility of our approach has allowed EMR vendors to enter the Manitoba marketplace with a lower initial investment and enhance their EMR product over time based on customer needs. Standard certification is entry-level certification that includes assessment of Manitoba's baseline EMR requirements along with the eChart Manitoba launch specification, allowing end users to connect into eChart Manitoba within the context of the patient in their EMR. This level provides the vendor with flexibility to meet individual customer needs through certification against additional optional components. EMR vendors may choose to enhance their EMR product over time to achieve full integrated level EMR certification. The integrated level certification builds upon the standard level and provides a highly interoperable system that enables connections to other healthcare systems and important quality functionality. Target clinics include primary care or community specialty clinics of all sizes who are seeking high EMR interoperability and those involved in provincial initiatives, such as My Health Teams. Certified EMR products have completed the process to reliably and securely connect and integrate with provincial systems, ensuring providers have critical information to support quality patient care. Only Manitoba certified EMR products have the opportunity to integrate with provincial services, such as eChart Manitoba and eHealth Hub. Choosing an EMR that is not Manitoba certified will limit your ability to leverage these services and/or participate in these initiatives. Use of a Manitoba certified EMR may also be a requirement for participation in future provincial initiatives. An overview of the certification levels, including the applicable components, is available in the Manitoba EMR certification section of the Shared Health website. It's important to note there are several components to the certification process outside of Manitoba's control. We cannot guarantee a certified EMR product will remain compliant with all criteria over time. Changes in the EMR vendor marketplace, such as acquisitions of a product by another vendor, are also outside our span of control. Vendor sustainability should be a component of EMR purchasers' decision-making process when considering any product. You may want to confirm the ability of the vendor to deliver and maintain the current solution, as well as their plans to enhance the product in the future. Discuss frequency that product enhancements are made available to purchasers, by what method, and whether they involve a fee. Check customer references for level of satisfaction. Research or request information on long-term financial viability. Understand the position of the vendor in the Manitoba and the national marketplace. The Manitoba EMR certification section of the Shared Health website will be the key source for up-to-date information on the status of certified EMR products, including certification against optional components. Online resources are currently available, including the items listed here, as well as status updates on EMR certification activities. If you have questions, please contact the EMR Certification team using the information provided. Thank you for watching.